This video is all about an enzyme called CYP3A or CYP3A. CYP3A belongs to a superfamily of enzymes called cytochrome P450 or CYP for short. There are 57 enzymes in the CYP450 system, but only 6 or 7 of them work in drug metabolism. CYP3A is a hard-working enzyme with a very important job inside the body. Every day, CYP3A reports for duty, mainly in the liver and intestines, where it helps to process and break down medicines. CYP3A's role? Turning medicines into forms the body can use or remove safely. In fact, CYP3A, especially a version called CYP3A4, is responsible for breaking down around half of all prescribed medicines. That includes drugs for infections, heart conditions, anxiety, epilepsy, cancer treatment, and more. But like anyone with a big workload, CYP3A sometimes needs help or faces obstacles. Some medicines act as inhibitors. They slow CYP3A down, making it harder to do its job. Most CYP inhibition isn't intentional. It's a side effect of the drug structure and how it interacts with liver enzymes. Some drugs bind tightly to CYP enzymes, compete for their active site, or even cause the enzyme to break down. When this happens, the drugs CYP3A is trying to process build up in the body. This can lead to side effects or toxicity. Other medicines are inducers. These speed CYP3A up, making it work too fast. That might sound helpful, but it can mean the medicine is removed from the body before it has a chance to work. Let's look at some examples in practice. Statins are metabolized by CYP3A. If someone is taking a statin for cholesterol and they start an antifungal that inhibits CYP3A, the statin level can rise too high, increasing the risk of muscle damage. In some cases, inhibition is used deliberately. For example, ritonavir is given alongside other drugs to block CYP3A and prolong their action, allowing lower doses to be used safely. St. John's Wort is a natural product that induces CYP3A. If someone is taking an oral contraceptive at the same time, the increased enzyme activity can reduce the pill's effectiveness, and this could lead to an unwanted pregnancy. That's why it's important to know which medicines are broken down by the enzyme. These are called CYP3A substrates, and which medicines are inhibitors or inducers that can interfere with that job. If you're prescribing or reviewing medicines, especially when a patient is on several, always check for CYP3A interactions. Even one new drug can throw off the balance and cause problems. CYP3A might be small, but the job it does is huge. And when we understand how it works, we can prescribe more safely, adjust doses wisely, and prevent harm.